I got interested in international nursing. Well, actually, I've always had an interest, but what really lit my fire was in 1997 when I got to go on a trip through the Rotary. It's called Group Study Exchange. And every year, at least in the state of Iowa, and I know they do it in many states, but maybe not everywhere, but the Rotary sends 5 professionals to a different country every year. And it's always the country wherever the International Rotary meeting is going to be. So the year I got to go, it was in Guatemala. So we spent almost a month in Guatemala and a few days in Belize, and it was an amazing, amazing experience. I know it sounds so cliche to say, oh, that month changed my life, but it's true, it did. I just got to see so many things that I had maybe heard about, maybe thought about, but never really understood. I've worked public health a lot. That's a great deal of my work has been in public health. So I've seen poverty in the United States, but the poverty I've seen here in the States is nothing compared to a third world country. The homes, the standard of living, the hospitals, just appalling. When you have rats in the hallway and garbage lining the hallway of a hospital, it doesn't get much worse than that, I guess, maybe other than not having a hospital at all. But people lined up in the streets waiting to be seen, and they would come and they would stay maybe for a day or two to be seen in the emergency room. Just seeing it all and just seeing the level of need that was out there, and knowing that I could do a little bit to help, as a healthcare person, there was something I could do to help. When I came home, I told Norm, I said, that's my husband, Norm. He didn't go with me on that trip. That was alone. But I came back and I said, I feel like I've been shook up for a month, and I've just sort of had my eyes opened. I'm back here in small town Iowa. There's only 72 people in the town I live in. I said, nothing's changed here, but I will never be the same again. And I began with a fire and a fury to make plans to do a project. I guess I was a little overzealous at first. I was going to save the world there for a few months. I calmed down and got things more in perspective. I worked with contacts I made through the Rotary. Dr. Coy in Belize City was very instrumental. He introduced me to Julia Castillo, and she's the head of nursing for the country. They have a very military-like system of nursing. It's like they're colonels and sergeants and names like that. She was the top person in the nursing for the country. She got me cleared as far as licensure. She got me plugged into the Belize Family Life Organization, which works something like family planning clinics in health departments here in the States, do similar type of work. So I opened a clinic that had been closed for 5 years, and it had to close when they lost funding, international funding. They really count on that to keep their clinics open and to provide care for the women.